I'm Sister Mary Trinita Eddington, a Springfield Dominican sister, currently stationed in Jackson, Mississippi, and I'm currently working in a St. Dominic Community Health Clinic. And that's what I'm here to tell you about, is about the St. Dominic Clinic. In 1996, we opened our doors to the St. Dominic Community Health Clinic, which is located in West Jackson, which is a very impoverished area, and it was a community whose health care was being neglected. St. Dominic's Health Services became aware of the lack of health care in this area, and at this time they decided that they would move into this area even though the residents had access to the health care. They did not have any finances, no transportation, they could not visit the doctor's offices, and so we decided that we would go to where they lived and walk and move into where they lived in a small community, and that we would walk where they walked.
I am so satisfied.
When I came to this clinic for the first time, I was a dead man walking.
My Savior.
It seemed as though the homeless and the impoverished had carved out a place down there which they called Stew Pot. And this was pretty much their home, where they would gather daily. They would have their meals there. We thought this was just a perfect place for them to come for health care because they're relatively shy and they have to build up a trust. So we had to go into an area where they were. And when I decided that I wanted to go there, I found an atmosphere there that was extremely imperfect. And I found that I could be a need, that they needed me, and that I was a solution to many of their problems. Now we're up to about 35 to 45 patients a day that come through the clinic. 70% of the patients that we serve are homeless. I guess I found it very hard to accept the fact that in a country that was so richly endowed and abundantly blessed by our divine Maker, that we would ever even have this level of poverty in our nation.
It's more to me than anything.
The St. Dominic Community Health Clinic here is part of a Central Urban Ministry Center, and we also have where the community and the social service agencies have come together to provide a holistic approach to the care of the poor and the marginalized. At the present time, we have the Stew Pot Ministries here, which consists of the soup kitchen, the food pantry, and the clothing closet. We also have prison fellowship here. We also have legal services, and our St. Dominic Community Health Clinic is here.
The clinic offers to our community a means by which we can come in and be treated with respect. Sister Trinita is kind of like E.F. Hutton. When she speaks, everybody listens. And not because she does it forcefully, but because she is respected and loved, and her demeanor almost demands that respect and love. She gives it, and we give it to her. It's tough to hear something negative about the clinic because almost all of the community and even surrounding communities depend on the clinic for their medical needs. As we all know, anything medical is expensive, but you come into the clinic and sign the paper and you're ready for whatever you need. I think that this community would be not where it is medically if it were not for the clinic. The clinic has brought to us a level of medical care that's unsurpassed. We appreciate the clinic.
As of today, we've been open 17 years, and we have over 3,000 patients with open medical records coming into our clinic to receive continuous medical care with open medical records. And in addition to this, we also have 6,000 patient visits a year of other residents and clients coming to us just to have basic needs met.